I will discuss about the importance and technique of hand washing, which is very much essential for our normal life, even also medical profession. So hand washing is very important to protect yourself from disease and also the people around you whom you are giving some service. Like you can give service to your patient by operating surgery. So if you do not properly wash the hand, from your hand infection may propagate into the patient. So a patient being operated in the operation theater, which is completely antiseptic and bacteria proof weather. So there you are without washing hand, we use gloves after washing hands, we use mask, we use cap. Cap because from here infection may go, from mask by our breathing or by our mouth if we speak, from droplets infection may go there, and a patient who has got no infection, they are really infected. Your surgery operation is done on bones, operation done in abdomen or wherever it may be. So the infection will go and a completely healthy people becomes infected. So mostly like in our orthopedic surgery, bone surgery is very much sensitive. Once infection occurs in bone, it is permanent. Infection eradication from bone is very, very difficult, very, very difficult. So person coming with some fracture in the hip bone, thigh bone or wherever bone, you are using plate, implants, it must be very much sterile. So I will speak on some washing technique and hand washing importance. So hand washing means hand hygiene is the easiest and most important way to prevent spread of infection. What I told. So spread of infection from one person to another, then to another person. So it may also that. So you use your hands for almost everything. They are easily contaminated. So everything means we are eating food, we are serving food, we are operating, we are doing whatever thing is there. Before that, we have to wash the hands. So when you serve the food, when you eat food, so hand washing may be of many types. Number one, hand washing is social hand washing. Social hand washing, medical hand washing, surgical hand washing like that. So one person to another infection. In hospital, one patient admitted with gastroenteritis. Next patient is some respiratory disease. So gastroenteritis patient, gastroenteritis is cured and going in home with a in viral infection. Or viral, please come. So viral. So or a patient admitted with some one disease, he may get another disease from another person nearby. So that is also common hospital born. So we clean hair, contaminated hands, contaminated by stool, feces, urine, contaminated. Remove dirt. Sometimes dirt is there, mud is there, whatever it may be mud. And minimum number in hand, there nails are there, nail beds are there. On between the finger and there you will get minimize the number of organisms. The organisms are there. To minimize these things, you have to wash the hands. So indications. Hand hygiene is essential when hands are visibly soiled by stool. Before and after caring for a patient, you take care patient के द्वारा गली patient के धोली examine कर ली, you have examined the patient. So after examination or after dressing change, contact or caring for a patient, you are doing changing the bed. So caring for a patient or you are changing the catheter, urinary catheter. So you have to care for the patient. So before and after caring. Before caring, why? Before caring, hand may be soiled with some organism. So patient does not have that organism. So you have taken care of one patient, and if you take care of another patient with that soiled hand, contaminated hand, the patient from the previous one will be infected to next one. So clarify. Another thing. So before after contact with organic materials such as feces, wound damage and mucus. So mucus, মুখে dressing করলে if you are doing some dressing from nose, mucus from nose, oral mucus or anal. So these things, organic material, feces also there. In preparation for some invasive procedure, suction, catheterization, suction. Sometimes we you have seen, you will be when you will posted in medicine, what you will see for abdominal pain or abdominal surgery, you will give rice tube. So putting the rice tube, suction, before suction or after suction, we have to wash the hands. Catheterization, putting catheter for urinary catheter for some urinary tract infection, or sometimes we operate on the urinary tract, we give catheter. So catheterization or injections, IV injections, intravenous injections or intramuscular injections. So before that, these are the indications when hands are visibly soiled, caring for a patient, contact with organic material, preparation for invasive procedure. Before changing a dressing or having contact with open wounds, patient may come into hospital in emergency department with some wounds, maybe fresh wounds, maybe old wound. So you have some contact when you dress. Gloves is not there, or suddenly you are taking sudden contact with the patient's wounds. So at that time you have to wash the wounds hand before going to another patient, or keeping the hands in your pocket. So open wounds, dressing also. Sometimes wound dressing is necessary. Before preparation and administration medications. So before giving some medications, IV medication or oral medication, you have to inject. After removing disposable gloves. So we use nowadays disposable gloves is there. So use disposable gloves, remove it and wash the hand. Disposable gloves many times are unsterile gloves. So you have to, before and after using the toilet. So when you go to toilet for defecation or urination, after that you have to wash the hand before and after eating. Many times I have seen my friends, engineer friends, other friends, they like this, then take food. I told them that you did not wash. Well, I washed it in my home, very clean hand. You cannot tell anything. So before and after eating also, in Western countries, so nothing. I was in US. I have seen there just towel is there, and that. Then even they do not gargle with water also. So before and after eating, at the beginning and end of the shift. Shift means you are shifting a patient from this way to that way, this way to that way. So before and beginning and end of the shift, before and after eating, after going to defecation, in village you go, you will see after defecation they use mud like this, mud. You have not, I have worked in many places in village, 35 years back, 40 years back. I was in service for 40 years and I've seen that they are using mud or some other things, grass, washing with grass, and so these are unhealthy habits. So you see, this is like before touching a patient, you have to wash hands. Before a procedure, any IV procedure or suction, anything, then after a procedure or body fluid exposure risk, catheterization or sometimes abdominal paracentesis, a patient with ascites, a fluid in the abdomen. Ascites occurs in cirrhosis of liver or any kidney disease. Kidney failure, chronic kidney disease, patient needs dialysis, they have got huge ascites, cardiac disease also ascites occurs, heart disease. So after procedure and before procedure, After touching a patient, even after touching a patient also you must use. After touching a patient's surroundings, if you patient surrounds with beds and around the cabin, so you have to, these are the points when this is only for patient's procedure I have shown you. So hands flora. What are the hands flora? This is resident flora, this is transient flora. So resident flora are deep-seated. Deep-seated, difficult to remove. Part of the body's natural defense mechanism. It is deep-seated, body's defense mechanism is there. They are the defense mechanism and we cannot remove it. But superficial transferred with ease from one hand to the another hand, from hands. So these are the transient flora, important cause of cross-infection. If you do not wash, if you associated infection following surgery, invasive procedures. So the associated infection following surgery or invasive procedures. So resident flora causes infection only after surgery or invasive procedure. But these are superficial flora, you will take to some work, social work, cross infection from one person to one person. Easily removed with good hand hygiene. What is good hand hygiene? How to wash and how long to wash a hand, we will tell. Hand hygiene includes hand washing, washing hands with plain soap and water, antiseptic hand wash. You will find in the market antiseptic bottles are there, antiseptic hand wash, hands with water, soap and other antiseptic agents. Alcohol based hand rub. Like in Corona season, you have seen we have got alcohol based hand wash, rubbing hands with an alcohol containing preparation. But that is also should be used after hand washing. Whenever we see patient in our chamber also, or somewhere else, taking in aeroplane, we are taking food, we just wash with their hand and take, but not that. You have to wash the hands first, then only rub with alcohol. Surgical antisepsis. Washing hands with antiseptic soap or alcohol-based hand rub before operation with surgical personnel. Surgical personnel means the surgeon himself, sisters, OT assistants, everybody have to wash their hands. And they have got special sterilized dress. So if you go for surgery, so in OT you go, the OT dress is there, all are sterilized. From here, everything you have to change your dress and you have to bath. You have to take bath before going to surgery, OT. Every day you must take bath. But in OT especially you have to take bath and new dress and you keep the dress aside. OT dress will be there provided and you go to. Because you can do no harm to the patient. You cannot do harm. From your source, one patient is infected, you are a criminal offense you are doing. And at the last time, the patient will be admitted in your ward and patient is infected. You have operated. A patient was all right, fine. While you discharge, there is infection. Your headache will not go. Your headache will increase. You are in a shoot. Every night you cannot sleep. Because you are giving infection. Every night you will think that whatever I have done to the patient. So, hand care, nails. Nails should be trimmed. How much trimmed? Rings. Somebody has got ring around. You have to remove. Hand creams. You cannot keep hand cream. Hand cream you have to wash. You should not have cuts and abrasion. So, very careful. If you are doing some work at home, cutting vegetables and cutting your hand and going to hospital. So, you will get some infection from there also, hospital. Nosocomial infection, you can get infection from the patients or you can be a source of infection to the patient. And skin problems. You have got khujli hai, dermatitis, scabies. So, scabies is very common disease. So, these may also be infect the patient. So, you have to, sometimes you have got bangles. Bangles you have to remove in surgery. So, bangles, these things you have to remove. On a case, ভাই ফোঁটা রশি লাগিয়ে গেলাম, that is also not allowed. So rings and jewelry. Studies have demonstrated that skin underneath the rings are more heavily colonized by bacteria. So skin and compared to the area skin on fingers without rings. So if you compare the finger without ring, this is without ring, this is with ring. So these area beds under the ring is more infected than the fingers not without ring. Fingernails, keep fingernails short, not excess 1/4 inch. So big nails, decorative. So you cannot give it for surgery or what. It may infect the other people, it may infect yourself also. From patient, infection will come. Avoid artificial nails sometimes and also nail polish. So I have given some diagrams. This is long nails. This is nail polish, artificial nails. This is artificial nails. This is nail polish. So everything should be avoided. Equipment. What are the equipments? What are the things needed? Sink with warm and cold running water. So the warm. You see there is a term warm. So warm. It should not be hot. Too much hot water will cause burn, scalding, so that you cannot. Tissue paper should be there or small towels, sterilized towels. In OT, we have got sterilized towels. So after washing, we wash with sterilized water. We make it dry with towels. Trash with nail cleaner. You will see there is a. This one, water is common. This one, all diagrams are given. Soap dispenser or soap and soap dish. Soap dispenser. You can soap dispenser this one, or you can soap can. So you can keep it everything. Or you see this is available here also. Here you can take out this sterilized small tissue paper. So these are the things that when you during and after hand wash. So procedure. So inspect the hands. So the rationale is observing for visible soiling, breaks, cuts on the skin and cuticles. So these things you inspect. And poor personal hygiene and open area of the skin provides an area which microorganisms are able to grow. So if there is abrasion মানে ছড়ে যাওয়া, or lacerated wound, that is a laceration means a deep type of abrasion, so that is skin is not intact, skin is broken. So in this case, poor personal hygiene, visible soiling থাকলো, determine the amount of contamination you have to determine how much contaminated your hand is and determine the type of hand hygiene needed. So determining the amount of contamination of the hands, after this, only by this you can determine the type of hand hygiene needed. If you know the contamination is more, the hand hygiene to be taken is more. Assess the areas around the skin that are contaminated. So areas which are more contaminated, and after hand hygiene during and to prevent contamination of hands during and after hand hygiene procedure. So contamination of the hands prevented. Remove jewelry except plain wedding bands and push, wash and long sleeves above the. So there are two types. If for social hand washing, you have to remove up to this much. But for surgical hand washing, you have to wash up to elbow. So this for social hand washing, you can remove jewelry except plain wedding band মানে যে মেয়েদের একটা শাখা থাকে ওটা for social hand washing. But for surgical one, you have to remove everything. So elbow up to elbow, you have to adjust the water to appropriate temperature and force. So, if the force of water is more, it will spill here and there, outside. You shirt, you dress. So, you will go this way. Wet the hands and wrist under the running water and always keeping hands lower than the elbow. এভাবে রাখবে, ঠিক আছে? Keep the hands like this, because otherwise this will soil this one. So hands are the most contaminated part of the upper extremities. Water should follow from wrist, least contaminated areas, over the hands, then down the drain. But after washing the hands in surgery, we keep the hands like this. Why? Because these areas are more contaminated than this area. So we will operate with the hands. So if we keep the hands like this, the contaminated water from here will drain to the uncontaminated, more important part of hand. So we put like this and we enter the OT like this. Their towel is ready, sterilized towel, and we dry it with sterilized towel and take gown. Gown is tied by sister or assistant from behind, because you cannot touch anything more. Lather hands with liquid soap or any soap. Wash hands thoroughly with the palms. So you lather means make it foam. Someone so many times, so there will be foam. This foam and soap and leather emulsifies fat and aids cleaning. The soap emulsifies fat, so they help to clean and loosen soil and microorganisms, both resident, normally present, and transient, both. If more soil, বাংলা বুঝলে সাবানের ফেনা যত ভালো হবে, বেশি হবে, তত দি ব্যাকটেরিয়া কমে যাবে. Bacteria will be reduced more, even if resident is deep one or superficial bacteria. Rub palms together. You see how step one. You should like this. Then I will show you other. Rub palms together. So step by step in a circular motion. So, and one by one I will show you what are the steps of hand washing. You see step 2. Step 1 I have shown you. এই দেখো, step 2. Step 2, retinal. Rub the back of both hands. ওই দেখো, like this. এক হাত আর এক হাত. Interlace the fingers. Interlacing. This is called interlacing. And rub the hands. Interlace and rub the hands together. This is more when you go to third year and OT, and you will see how surgeons are washing the hands. Then you see interlock. Then you have to wash like this. One finger. Rotational rubbing of the left thumb clasped in right palm and vice versa. So you see rotational rubbing backwards and forwards. This is theory part, this is practical part. Practical part is see, we are saying 7 step. Rub finger tips on palm for both hands and rub both wrist in a rubbing manner, rotating manner, like this. So the hand washing is very important. Wash for 50 to 30 seconds. So this 15 to 30 seconds is for social hand washing or medical. For surgical, 2 minutes. 2 to 5 minutes, depending on your soiling or contamination. If the contamination is more, 5 minutes or 2 minutes is sufficient. 2 minutes, 12. But medical hand washing, normally 15 to 30 minutes, 20 seconds we do. 20 seconds. Rinse the registered hands completely. Keep hands lower than the elbow. So, but for OT, dry hands thoroughly with paper towels. Start by patting at fingertips. প্রথমে যে when you will do patting with towels, you will fingertip first, then go downwards. Fingertip first. And when you put in OT, when you enter, not like this. You have to put like this, OT, surgical OT. So, you should go progress from clean to less clean. And the cleanest areas are now your fingers and hands. If you go from finger to gun, this is the cleanest area, first. So turn the faucets, you see, this one, and keep skin soft and lubricated so it will not crack easily. So use hospital. These are sometimes hospital approved reference is sometimes given, not given. And how you close? This tab is there. Normally we close it like this. This is tab coming on, so we do not touch. Somebody goes without closing it, so water come on wasted. So we will close like this. Inspect the hands and nails for cleanliness. Provide patient teaching and explain to the patient the importance of hand hygiene. So this is hand hygiene. How much importance you have to tell the patient for social hand washing, medical. For you to accept social and medical, you need to know the surgical hand washing also. What I told. You see, hand hygiene frequently missed areas. You see, these are the areas missed. This area, you see, these are areas not sometimes missed. I have given the green color. You see, many areas. Remember, bacteria and viruses can cause illness, even death also. So death may occur because many viremia occurs when the virus goes into blood, viremia. When it is called viremia. When the bacteria goes into blood, it is called bacteremia. So that will go to even serious septic shock, bacteremia, and this one sepsis will occur. Patient will have meningitis. And remember, no matter where you are, no matter where you do, wash your hands. So you see, he is pulling the rickshaw. Where you see. ড্রাইভিং হোয়াটএভার ইউজিয়া বলে না গটের স্টেপন করেছি কিছু করতে হবে না হাতটা মুছে খেয়ে নিলাম আই এম জাস্ট অন দি কোর্ট আই ওয়াশ সো ইউ সি হি সিঙ্গিং অ্যান্ড বাট কামিং অ্যান্ড টেকিং ফুড নাও এভরিবডি ইজ গোয়িং আউট উইথ ফুড প্যাকেট আই হ্যাভ সিন and they will take food. So now after knowing these things, I think you will not forget to wash the hands. You will be afraid to know the bacteria. So very important is hand hygiene. You have to know the hand hygiene, social hand hygiene, medical hand hygiene, surgical hand hygiene. Surgical hand rub, hand wash. So hand wash is very important. So you remember this and practice hand washing every day. We have got disinfectant here in our bathroom. Use this one before taking food. Okay, thank you.